Welcome everyone. So in this episode, I wanted to talk about behavior change intervention and how our new Fibion Helix wristband can make those easy. And I think the behavior change is an important thing. We know quite much about advantages of physical activity, advantages of avoiding excessive sedentary behavior. But the problem is, how do we get people to do those? So that comes down then to behavior change studies. And if we look at Fibion Helix, so it is like a consumer wristband. From the looks, it's as easy to use for participants as those. But the good thing is that it has a participant app that can give really nice feedback for participant. But for research project, it provides the raw data. So you get 3-axis acceleration, you get the heart rate variability. So it's a good mix combining and the convenience of consumer trackers and also the optical heart rate variability sensor, but then the features that researchers actually need to be able to make studies that are valid and that they are able to actually publish them. Consumer activity trackers, for example, might change the algorithms during the study, and then you cannot really know whether those changes in the behavior of participants or something just changed how the data is analyzed in a consumer activity tracker. And Fibion Helix provides metrics for sleep, recovery, physical activity. It also gives VO2 max estimation from the normal daily life measurements, and it can provide real-time feedback of these metrics. Also, researchers can export these in a CSV format for the studies, these metrics, and it's an easy feedback loop for studies aiming for behavior change, so participants can use just a smartphone app to see the data, see those, and be able to change behavior based on those. And often this is challenging to provide feedback for the participants if you don't have a dedicated app, and building an app is usually much more challenging than people who are not doing programming think. And if the app is not the perfect fit for your study, there is also well documented SDK. So basically you can use the software development kit to integrate this data into your existing app and integrate it to an existing, for example, ecological momentary assessment app that have been developed for research. Or you can develop your own, and then you are able to tailor feedback exactly for your study goals, for your study needs. And the Fibion Helix, it's lightweight wristband. It is easy to wear for long times, and it has a patented optical sensor for heart rate and heart rate variability. So basically it's combining the 3-axis acceleration signal, and it can filter out the movement artifacts. And it also has a patented multicolor LED, and it has several LEDs. So basically it can compare between different sensors, and those should be similar enough. If the data is not similar enough between different sensors, it can conclude that's probably an artifact and not actually a volumic change in the blood. So it has a very good artifact removal features. So what the researchers get is much more accurate and valid and reliable heart rate and heart rate variability data. And when you're doing a behavioral study, you can, for example, use the resting heart rate, improved VO2 max, heart rate variability to demonstrate the physiological benefits of positive behavior changes. Or if you're aiming for a better sleep, for example, then you can look the sleep metrics. And if we look what kind of behavior change studies you could do, some examples, you could do physical activity intervention, you could track increases in daily activity and reductions in sedentary time with real-time data to encourage participants. And you could, for example, have triggers to notify participants when there is certain amount of sedentary behavior, encourage them to move. You could look sleep improvement programs, provide insights into how changes in habits or sleep hygiene impact sleep quality and recovery trends. You could be looking stress management studies. You can look heart rate variability data to monitor the effects of interventions aimed at reducing stress, for example, in occupational settings. Or you could have a study about chronic disease management, supporting patients adapting healthier lifestyle by showing them how small changes contribute to improved metrics over time. So that's basically it, a quick overview how you can use Fibion Helix in a behavior change studies. If you're interested to learn more, check our website, Fibion Helix at fibion.com. Feel free to send us a message from there or book a call with me or Dr. Miriam Caprita, and we are glad to have a video call and see if this could be a good fit for your project. Thanks for listening and have a brilliant day.